Hey guys, good morning. I hope you had a happy holiday. I just want to go over a little bit about some of the basic lab values that we're really going to be using in the community paramedic program. Just really three tests that I really want to go over. The first one is going to be our BMP. Now, our BMP is known as a basic metabolic panel. It used to, back in the day, some of us may have heard of it, known as a Chem 7, but now it's known as either a Chem 8 or a Chem 8 plus. All of these things are going to be the basic metabolic panel, or BMP. So we're going to talk about what the basic metabolic panel was looking for. So the BMP is taking a view of how our body is functioning metabolically, how we're taking in nutrients, how we're taking those nutrients and creating energy with it, and all of the things that are needed to create that. So let's take a look at what's found within it. So the first thing is we want to look at is our glucose level. Now, most of us as paramedics are pretty familiar. It's one of the lab values that we do get in the field during our patient assessment is a finger stick glucose. I want to make sure that our glucose is between 70 to 130. This is a normal glucose level. All right, let's take a look at some of our electrolytes here. Our sodium level should be between 135 to 145. Next up is going to be again, that is sodium at 135 to 145. Potassium should be between 3.5 to 5. All right, these are our serum sodium and potassium levels. Our chloride should be between 97 to 107. All right, so right here, these three are going to be the electrolytes that are going to be found within the BMP. Now, CO2, all right, you have to remember that this is not the end-tidal CO2 that we're going to be looking for when we're looking at like capnography, for example. This is going to be a little bit different. This could be between CO2 and bicarbonate. And so this level, CO2, is going to be between 22 and 26. Now, these two levels together, our BUN and our creatinine levels, are going to be really, really important when we're looking at kidney function and seeing how not only are we taking in nutrients and everything, is seeing how the body is ridding itself of some of the byproducts left over from basic metabolism that the body has. So the first one is our BUN level, all right? Remember that this is how urea is getting filtered through the kidneys, and we can tell how well this is going. Now, normally your BUN level should be between 8 and 21. 8 and 21. Numbers higher than 21 can indicate the possibility for kidney disease, dehydration, things like that. Our creatinine level, all right, our creatine level should be between 0.6 to 1.2. So our creatine level is 0.6 to 1.2. And remember, these numbers typically correlate together. Your BUN and your creatinine, looking at how the kidneys function. Now, I'm going to do another video here in just a little bit, and we're going to talk about a little bit about liver. All right, some of the liver enzymes and some of those levels that we're going to get within those tests, or LFTs. All right, so let's take a look at one of the other panels that we're probably going to look at with a lot of our patients. All right, so we've got our basic metabolic panel that we just did, which looks at essentially taking a look again at what's going on metabolically with the body. So now let's take a look at what's known as the CBC. Now, the CBC stands for complete blood count. So we're going to be taking a look at the blood count and what's going on with it. So we're going to take a look at a couple of numbers here. All right, so hemoglobin. Now, we know what hemoglobin does, and its function and its purpose is essentially hemoglobin is a transport. All right, it picks up and takes, hopefully, it's carrying oxygen molecules all around where it needs to around the body. But we have to understand that hemoglobin can also pick up other things, notoriously carbon monoxide. Your hemoglobin has, I think it's like 100 times more the affinity to pick up carbon dioxide versus oxygen. So be careful is that, if you're using one of the SpO2 probes, that if it says 100% on there, that it might not be 100% oxygen. It could be other things as well. So normally your hemoglobin should be between 12 to 17.5 normally. Again, that's 12 to 17.5. Your RBCs, which is the number of red blood cells, is usually between 3.9 to 5.5. Now, the platelet count, now remember what platelets do. Now, red blood cells, we're going to go back to that just for a second, all right? We know what red blood cells do, all right, that it's associated with hemoglobin. Now, platelets, we know that the function of platelets is in the clotting process, all right, as they bind together and that they help to develop clots. Now, your normal platelets should be between 150 to 350. Your hematocrit. Hematocrit is basically the percentage, all right, is the percentage of red blood cells that is found within the body. And your hematocrit count should be between 34 to 52. Now, remember, some of these numbers are going to be, especially like your hemoglobin, red blood cells, and your hematocrit are going to be slightly different between males to females. And I'm going to put in a little chart to send out to you guys here in a couple of days that shows the difference between those two numbers. But if they fall pretty roughly between that, as long as they're not critical, you're going to be within the right lab values for the exam, or knowing what's going on with that patient, all right, if they're bleeding or not. All right. White blood cell count, your WBC. Now, this is a total WBC count. Now, we're going to talk a little bit here in just a second on what's known as a differential. Now, your WBC count, white blood cell count, should be between 4.5 to 11, 4.5 to 11. Now, that's the total number. Now, a lot of times, you may get what's known as a CBC with a differential. Now, what the differential is it is going to figure out what is the different types and the number of different types of white blood cells that are found within that total WBC. And this differential is going to let us know. So let's say that we have a patient who comes in, they're presenting with symptoms, and we see that their WBC is elevated. Let's say it's outside of that range, it's greater than 11,000. And so we're looking at their WBC count, and now we're having to decide, okay, what's causing this? All right, is it perhaps it's they have a virus? Is it bacterial in nature? Is it due to an immune response, or is it due to inflammation? Depending on the type of WBC, it's going to let us know what is going on in the body, all right? Which if we know what's going on in the body, it's going to help us to hopefully being able to enact the proper pharmacologic agent to present to this patient in order to relieve the patient of the symptoms. And so this is very important. This is why it's so important for us to get a WBC when we get a CBC with a differential, is because knowing the difference in those WBCs is going to be very important. And I want to go into a different video here in the next couple of days. It's going to go over what the differential is and what each one of those cells, when we have these different white blood cells, these WBCs, which ones they mean and can tell us what's going on with that patient. The last thing I want to look at is because a lot of our patients within the community paramedic program are going to have, a lot of them are going to have a lot of cardiovascular issues, or they've had a stroke, they've had a heart attack, maybe they're on lots of different medications, and some of those medications are going to have to deal with clotting. All right, so we're going to be looking at some clotting factors and some clotting numbers here. All right, especially patients who are on things like warfarin, all of those kind of fun medications, Xarelto, for example. So we're going to be looking at clotting, but also this is going to be important for patients who may have clotting disorders such as von Willebrand's disease, hemophilia, and things like that. So we're going to look at some of these different things. So PT, all right, prothrombin time. Now, what this is this is the time that it takes for your body to hopefully to be able to develop a clot, all right? So the normal prothrombin time or PT time should take between 10 to 13 seconds, 10 to 13 seconds. And all this is looking at is how long the body should take to be able to form a clot, all right? So this number is either going to be reduced, all right, is because it's going to, the number is going to be, the clotting time is going to be reduced. Let's say that patient's on anticoagulant therapy, that's going to be a normal finding, all right? However, if this clotting time is normal or outside of the range for a person who's on anticoagulant therapy, we know either that they're not taking their medication like they should, or the medication is not effective. And either way, we're going to have to adjust some medications for that patient. Which brings us to the APTT. All right, this is that's going to let us know how effective that medication is, that the patient is clotting. All right, and this should be between 25 to 40 seconds. All right, 10 to 13 for PT. PTT is 25 to 40. Now, the last thing is known as the INR, all right? So what INR does is INR comes together to be able to basically standardize these numbers so that there's a formula that the lab uses to be able to correct that. Now, your normal INR number should be between 0.8 to 1.2. However, patients who are on an anticoagulant therapy, again, we would see that this number would be much higher, all right? It could be like between numbers of like 2 to 3. As if we're seeing those numbers that are 2 to 3, it's not cause for alarm for a patient who's on anticoagulant therapy, is because the reason for that is that patient's medication is working correctly. But if we have a normal to a low number on a patient who should be utilizing anticoagulant therapy, if that medicine is not working effectively or they're not taking their medication like they should, we're going to see where they could be developing an increased risk for clotting later on. So this is really important. So again, guys, these 3 tests are going to be super important to a lot of our patients that we're going to be chronically managing a lot of their medical conditions, a lot of their chronic stuff, we're going to be looking at. All right, so we're going to be looking at the BMP, basic metabolic panel, CBC, which is the complete blood count, and our clotting factors. So I'm also going to do a couple more videos. It's really going to talk about some of the more lab values that we're going to see. We're going to be looking at BMP and some of these other things as well. So I hope this helps out and gets you going in the right direction. What I just posted on the board here is great to be able to put on your dump sheet for when you're studying and getting ready to take the CP-C exam. So I hope this helps out, guys, and I will see you in class very soon. Have a great day. It's always good to see y'all.